and the team that participated with us. So really appreciate it. So our speaker today is NASA flight surgeon, Dr. Stevan Gilmore, the International Space Station Program Medical Officer. He's also the Deputy Chief Space and Occupational Medicine within NASA's Human Health and Performance Directorate. Dr. Gilmore is an expert in planning and providing medical support to the crews staying in our world's most remote, extreme, and resource-constrained environment, which is the International Space Station. He has served as lead physician for 11 ISS expeditions and 3 space shuttle flights. Currently, he's supporting the first crew to fly on the Boeing CST-100 Starliner spacecraft. The crewed test flight is due to launch in the coming months after the upcoming uncrewed orbital test flight that's taking place later this week. So one of Dr. Gilmore's best known accomplishments is his support for astronaut Scott Kelly's year in space mission in 2015 and 2016. That was one of the focus areas we had at the ISS R&D conference a few years ago, so this should be really interesting. So innovative technologies and procedures used to provide care during that landmark mission are advancing to support caregivers and patients on Earth. Besides his training and certification in emergency medicine and aerospace medicine, Dr. Gilmore also holds a master's degree from the University of Texas, where he studied technology commercialization. We're very happy to have him here with us today. So welcome, Dr. Gilmore.
Thank you very much. Thank you to Boeing and NASA and Dr. Martin for the opportunity to talk here today. Let me just go ahead and share my screen here, and we'll get started. I thought I'd talk a little bit about the Year in Space mission and flight surgeons. I'm real excited to be talking to this group in particular because I view myself as a lifelong learner. I think that's maybe one of the things you heard in my bio. But just a little context for this photo that you're looking at here. This is myself and Scott Kelly, the crew member, and we're sitting in a helicopter in Kazakhstan about 2 hours after he landed, after spending 340 days in space. And obviously this was NASA's first long duration mission. It was 340 days in total. But in preparation for the talk, I wanted to tell you a little bit about the context of how I found myself sitting in this helicopter with a crew member who just completed a mission like this. And in preparing for this, I kind of went back and looked at my own history. And when I was between my junior and senior year in high school, I actually, around about this time of the year, actually, I spent most of my that summer doing a student exchange program in the Soviet Union at that, which was obviously a large group of countries at that time. And we spent time in the Moscow area and then some of the northern Baltic states, getting to know the people and how they lived at that time in 1989. I was fortunate to have parents that really encouraged us as kids to gain some international travel experience because it gives you a good perspective on the world around you and how other people live. And that's one of the themes I wanted to bring forward from this talk for y'all is to, in addition to exceeding and doing well at your studies and the things that you're interested in, is finding the things that you enjoy in life and pursuing those and incorporating them into your career going forward. So again, this is a picture of me at one of our visits, and we are, there's a static display of a Russian aircraft there, and you're going to see this theme throughout my presentation here. So the other thing I was fortunate to have when I was in high school was a great chemistry teacher by the name of Mr. Medic, and I pursued an undergraduate degree in chemistry, but ultimately decided to go into a career in medicine, and went to Wake Forest University, where the starting part of medical training is pretty standard. You go to 4 years of medical school, but in the last 2 years is when you really start picking up a lot of clinical experiences. And I was having a difficult time in my third year trying to decide what I wanted to spend my professional career doing. And I took a chance one time and went to listen to a talk by someone from a physician astronaut who was on a recruiting trip with the Navy, just to hear about the kind of interesting jobs that are available in the federal government and obviously at NASA. And I was really excited by this, and found that as medical students, you could do some training at the Kennedy Space Center and then also at the Johnson Space Center. And these were really amazing experiences for me when I was in my third and fourth year of medical school. At the Kennedy Space Center in 1998, that was a very exciting time to be around the space program. They were launching, between 3 and 5 shuttles a year. And so when I showed up, I had the opportunity to see a shuttle launch a few days after I arrived for my 1-month medical clerkship. It landed 2 weeks later, and then another shuttle was launching the week after I left. But during this time period, it was really packed with activities. In addition to the shuttle launch, you can see a photo of me here and some of my colleagues in one of the processing buildings where the shuttle Atlantis was getting prepared for launch. We also got to do some interesting medical planning and training exercises in the field. The photo on the top left is sort of me dressed up in a high altitude spacesuit, and we're participating in a medical simulation at one of the triage sites that they have at the Kennedy Space Center. So if for any reason something went wrong on the ground, there's a medical system that's in place at launch, and you have to be prepared to take care of injured personnel and crew members there. So that was just kind of a run through of that. And then some of the photos on the right there are me and some of the other, some of my colleagues that were also medical students that were on the rotation. And we were doing some simulated medical transport training and flying around in the helicopters that they have at the Cape. So that was another fun activity that involved aviation. Later in my fourth year, I went to the medical clerkship that they had down at the Johnson Space Center here in Houston, and again had a wonderful experience learning about the human spaceflight program. And then they got us involved in some of the operational things that they were doing at the time. They used to have this plane called the Vomit Comet, or the KC-135, which you can see the interior of there with me floating around. But by flying the plane in parabolas, you get about 30 seconds of no gravity. And so that was a really fun experience and a different environment than really I'd been learning about in medical school. So I took this exposure to aviation and aerospace medicine in NASA when I was in my fourth year of med school. And I went on and did an emergency medicine residency. And during that residency, one of the things that I had the opportunity to do was a medical mission trip to Mozambique in 2000. And they had experienced some really severe flooding. And a couple of my emergency residency colleagues and I went and spent a couple weeks flying around in they're called Alouette helicopters. It's in the bottom left photo there. So we were going out doing medical therapy for folks out in the backcountry in Mozambique who'd been severely affected by the flooding. And you can see sort of a representative picture of that up in the left-hand corner. But this was also a really eye-opening experience for me at the time that I was training in emergency medicine. You really got to have a different experience than most people get when they're in training, because a lot of modern medicine as we know it really relies on being inside a medical center and being out in the field where there's potentially hundreds of people that could benefit from technology and pharmaceuticals that we had available was really a different experience than what we were training as at the time at the state of the art in emergency medicine. But again, it fit into one of my things that I really enjoy doing, which is traveling and seeing the world. And over the course of 6 weeks, hopefully my colleagues and I were able to bring some assistance to the folks that needed it there in Mozambique. So let's come back to this photo of the Year in Space landing day. This is obviously a very exciting day. You can tell by the expressions on both of our faces. What most people don't see a lot about is the day as it looks like for a support person like myself. So this happened in Kazakhstan, and we're embedded there with our medical colleagues from the Russian Space Agency. And so our day on a landing day starts out in the back of a Russian Mi-8 helicopter. And this is a shot of the air crew looking out the front of the helicopter. And there's a small flotilla, if you will, 10 to 12 of these helicopters that are out on the landing to support the crew. And so, you know, everyone's looking to get a glimpse out the window of the Soyuz vehicle as it comes back to Earth. And this is actually a photo of the Year in Space crew in their Soyuz returning to the ground. This is a snap or a quick photo out the window of our helicopter as we're landing, and you can see there's 4 or 5 other helicopters in the process of landing there, and you can see the parachute spread out on the ground. As we zoom in a little bit closer, obviously everyone grabs all their equipment that they brought with them in preparation for getting the crew out of the vehicle. And you can see the specialists are safing the vehicle and then mounting this structure on top of it so we can get the crew out. And then, of course, here's a photo of the crew getting out of the vehicle. And that's sort of where a lot of work begins in terms of what the physicians do, and then also the researchers that are doing research. Now, I pulled a video that's available on YouTube, and I'm not sure if the audio will come through, but this is Scott talking a little bit about this day, and I thought it was useful just to show you as opposed to trying to tell you what crew look like when they come back. So this video is shot and so Scott's just talking about how they do measurements right away. And this is the first time he stood up. And he's participating in a science experiment here where they're sort of documenting his ability to stand up and his coordinated movement. And he talks about repeating this testing multiple times as he gets back, so that this photo, he's back in Houston. We took an airplane ride back to get to Houston, but he's doing tests every day during his return to measure his improvement as a result of having been exposed to space for a year. So I don't know if, hopefully that was useful. If you look on the internet, you can find that video and hear his narration of it. I'm not sure that came through as I was talking, but again, the point of it is just to show there's some change physiologically in folks when they get back, and we want to understand that. These longer and longer duration missions like the Year in Space give us crew members with more time in space that might look something similar like a mission to Mars, for example, where you might be gone for up to a year or two to sort of see what you can expect from folks during the course of that process.
Dr.
So
Gilmore, this is a 5-minute warning.
Okay, 5 minutes, good deal. So just at a high level, what are flight surgeons? We're not surgeons per se. That's a term that's brought from the military, but we are physicians that have specialized training in aviation, special and extreme environment physiology. And I've talked a little bit about my pathway, but med school, Folks typically do a primary residency in emergency medicine, internal medicine, surgery. Then they have a little bit of training in aerospace medicine. That's a second residency. And we do some specialized training here at NASA. But basically, we have a lot of utility for special environments like diving medicine, high altitude, acceleration, and the aviation environment. So here at NASA, flight surgeons provide the medical support necessary for astronauts to perform their required duties and assure mission success. We also are a member of the flight control team in mission control. So there's a picture of that up on the left. And then we support these unique environments that crew train in, like the T-38s. We're qualified to fly in those along with the crew, so we understand that environment, acceleration environments as well. You all are probably well familiar with hazards of space flight, but we kind of group them in this way: the space environment, the spacecraft environment, and then unique aspects of the spaceflight mission. And there's some big areas that are hit that are commonly known. Space motion sickness hits the neurovestibular system. The cardiovascular system is affected right away by fluid shifts when folks get in space, and then the amount of work that people can do, their aerobic capacity is decreased as a result of not having been around gravity. And then muscles and bones change as a result of not having to work against gravity. One of the main points of this one-year mission, you can see this chart here, it's scaled to a 6-month interval, and we were interested in quantifying the extent to which the various physiologic systems are changing in people when they're in space for a period of a year. Motion sickness, space motion sickness is a phenomenon that affects a lot of crew. Most of them not all that severely, but it's a similar motion sickness that you might get on a boat. The difference is that we can't really predict who will get it in space versus folks that get it on ships on the ground. There's not really a correlation there, but you could have just a loss of appetite up to nausea and vomiting. It's a fairly controllable symptom complex, and usually we have it resolved with the crew 1 to 2 days into the flight. And it primarily happens because without gravity, you can use all surfaces in a room. So you can sit on the ceiling and be upside down, and it just takes a period of time for your body to become, and your nervous system to become adapted to operating in this kind of new motion environment. Fluid shifts, as you all know, your heart and blood vessels are very well adapted to having gravity. And the result of this is you have extra fluid on the venous side of your cardiac system when you go into space, because you don't have gravity pulling it down into your legs. So your body over time will get rid of that fluid, and you'll have a new equilibrium point with a little bit less, about 10% less total body fluids. And that can cause some problems if we don't prepare for them when people come back from space. But here's an example of the fluid shift. This is a crew member who would have launched on the Soyuz rocket, and then within a day of launching, you can see sort of the obvious physical difference in his face, and that's due to this fluid shift. And he'll, over time, lose that extra fluid, as I talked about.
Dr. Gilmore, this is a 1-minute warning.
1 minute warning. Okay. Well, we've got, obviously, without gravity, your heart and muscles don't have to do quite as much work because they don't have to work against gravity. So, and we can measure that change in peak work capability up to about 15%. And that usually peaks in the first couple weeks of a flight. I'll go ahead and just jump forward here. I know you guys are all studying genes and how to analyze them. Obviously, you understand the risk that radiation presents to folks. I had just a real quick slide on where a typical 6-month ISS mission fits in terms of other sort of common radiation exposures that you might get. And I'm going to jump forward to the end since I don't have a lot of time. We have some medical kits on board. We have an exercise system to help maintain the cardiac work output capability. One of the reasons we have the medical team is that we've had episodes in the past where the crew's health has impacted missions, both on the US side and the Russian side. And so we really want to do our work ahead of a mission or before a mission by selecting healthy people and preventing medical illness from impacting what can happen during a mission. So I'll just kind of wrap up with coming back to the year in space. Obviously, I think you all are familiar with the twin study that was associated with that. Scott has a twin brother who is also an astronaut, and they did studies on the two of them. Mark was on the ground while Scott was in space. And there's a lot more information about the results of this study. You may have already be familiar with them from your work this summer. And one of the tests that I was involved with peripherally and most interested in was the results of Scott's participation in taking flu shot testing while he was in space on the mission. But if you're interested in more information about the findings of the twin study, you can see a website there that I have linked on the page. So that's it for my presentation. I'm sorry I had to rush through a little bit of the end of it there, but certainly available for questions. And lastly, I want to thank Boeing for the invitation and NASA, and I'm really excited for everyone that's participating here. You've obviously being in the finalist round is very exciting, and look forward to any questions that you may have. Thank you.
Well, thank you so much, Dr. Gilmore. Now we have 8 minutes remaining for questions. So I'm going to ask folks not to unmute so that we can prevent some level of chaos. But if you can submit your questions into the chat, then I will share them with Dr. Gilmore. Dr. Gilmore, thank you so much for that presentation. You are a rock star to this crowd, and we are super delighted to have been able to host you today. Thank you for giving us your time. So let's see, first question is from Vivian and Erica Yee. This is one of our finalist teams who will be presenting tomorrow. They asked if you could elaborate on the difficulties of addressing health concerns in a unique environment where there is still so much that's not known about how space flight impacts the human body.
Well, there's a few things. I guess one of the things that I took away from my experiences, which I showed you throughout my training, is preparation. So we know a lot about the crews before they go, and you do correctly identify that we don't know everything about how the body changes that comes up in space. One of the things that I've really found to be valuable is getting to know your crews well, so that you can listen to them, you can look at them, and there's a lot of nonverbal cues that you can pick up on to tell if there's anything bothering them right at the moment. The physicians like myself, we perform sort of a unique role. We're not generally primarily researchers, but we support all the research by being the medical observer that's there for the crew while they're participating in the twin study and things like that. So just knowing your crew and their health well, it just pays a lot of dividends. I don't know if I've answered your question particularly, but I think you all having gone through COVID and doing a lot of training remotely, tele-learning, telecommunicating, that was a skill that I think is really key to put in your arsenal of things that you are comfortable doing, because a lot of what the medicine that we do is exactly this. I would when I'm on mission, I'll meet with a crew member once a week. We'll have a video conference for about a half an hour. I'll have a number of things that we talk about, but being able to observe them during those time periods and assess their health is very important.
So we've all been in training to become astronaut physicians. We didn't even know it over the last year.
Absolutely. Absolutely.
Our next question is from finalist Zach Finger. Zach is asking how long the effects of muscle atrophy lasted after Scott Kelly returned to Earth.
That's a great question. I didn't really get into it too much, but the crew members have a 45-day period that's called a reconditioning period, and that starts right away when they get back and continues for 45 calendar days. So the bulk of that time, well, not the bulk of the time, but every day pretty much during that time period, they're working with their trainers to return their muscle strength back to where it was, what it was measured at before they left. And typically, as far as the muscle strength goes, most people are pretty much all the way there in that 1 to 2 month period of time that happens. I have to say, I'm old enough that I've seen a couple different workout setups on the space station, and the machines they have up now really are a lot stronger than the crew are, and as a result, the crew are coming back in really excellent shape, all things considered. So the muscle loss is not as great as you might think it could be. So.
All right, our next question is from Aditi and Noah, who are one of our finalist teams. They ask if you worked with any female astronauts, and if so, was there any difference in how you approached their medical treatment?
Well, we treat each crew individually. I have worked with a few female astronauts, particularly when I was working on shuttle crews. I'll just kind of step back. When the crews go to station and they fly on, and they had been flying on the Soyuz, I would be working with 1 or 2 US crew members. Whereas when we had the shuttle program, you could fly 7 crew members at one time. And so the way you interface or interact with each individual crew member is a little bit different. But so there's obviously some unique women's health related things, just as there's a few special men's health related things. But we would obviously deal with each crew member individually and address whatever health need they have.
Our next question is from finalists Jaya J and Jaemin Kim. They are asking if flight surgeons also handle mental health concerns that ensue from operating in an isolated environment like the ISS.
Well, the good news there is we're part of a team, and we actually have some behavioral health specialists that if we needed to have them involved for those reasons, we certainly could. So the short answer is we would get some of the NASA behavioral health specialists involved if we had concerns, specific behavioral concerns. One of the similarities with those specialists and with the flight surgeons is that the crew members meet with us. They meet with the behavioral health team every 2 weeks on a regular basis, just to kind of so they're not coming in new, and they're familiar with what's going on with the crew when they're on mission. And similarly for us, we meet with them every week, and even if they're feeling well, we'll still have a conference with them just to kind of check in and see how things are going. So we take a preventative approach on both of those aspects.
Great, and I'm going to squeak in one more question before we wrap. This is from Maria Zeitlin, who sponsored one of our finalist proposals. She's asking, the environment is kept so clean before launch. What is the source of contamination that occurs to things like the water supply, things like the air supply? Where does that come from?
There's a couple places that it comes from. There can be some process escapes such that that doesn't happen very often, where things get launched and they have to, the consumables have to get remediated. The other thing that's really an interesting story to learn about is how on the space station they're trying to reuse as many of the resources as they have, and this includes one of the biggest ones is water, and I think they reuse about 90% of the 90 or 97, 95% of the water. And so when you have mechanical processes, there can be mechanical breakdowns or process escapes that introduce some, in the case of water, introduce water that you have to remediate or do something with. So I don't know if I'm answering your question directly, but we do the best to try to make sure that all the things that the crew are exposed to are cleaner than what they would be exposed to on the ground: food, water, air. And then we have systems in place to monitor whether or not that's true, to sample those things and make sure that it's clean. And if there's a problem, we have reserves that we can use, or we have techniques that we can re-clean these things so they can use it.
Wonderful. We are at the end of our time here, so I want to close again by thanking you so much, Dr. Gilmore, for joining us today. It was an absolute pleasure to hear from you, and an honor to share a Zoom room with you. Thank you so much.
Thank you, and the pleasure is mine. And there was a fun, I hate to make it what I did on my summer vacation, but it was a fun walk down memory lane. And I just encourage everyone to, NASA is obviously really interested in folks that like what they're doing and do it well, but obviously there's other elements of your life. For me, it was travel, STEM, and medicine. And there's ways to pull those things that you're interested in, whatever they are unique to each of you, into your career. And it just makes it for a real rewarding experience. So thank you very much. And I wish the best to everyone during this exciting week for Genes in Space. Thank you.
Thank you. That means a lot to us. And I just want to close today by giving a plug for the rest of our week's events for Genes in Space going forward. So as I said at the beginning of our session, we are choosing our 2021 winner over the next 2 days. Please join us on YouTube. You can follow along every step of the way. Our finalists will be presenting their ideas at 1 p.m. Eastern live on YouTube tomorrow, and then we'll be announcing our winner at the same time on Thursday. If you head to genesinspace.org, you'll find the links you need to access those exciting sessions. Thanks everyone for joining today. I hope to see you for the rest of the Launchpad.